Okay. Good afternoon. Thank you all for your patience as we verified and validated the data of the various COVID outbreaks that Manatee County government has been experiencing since early in May. We'll share some of these statistics. Nick will go ahead and email it to you, but just so that you get some of the information on tape, a summary report of COVID-19 cases among Manatee County government employees from May 3rd of this year through July 30th, 2021. We've had a total of 41 positive cases, 16 cases in utilities, 5 in information technology, which most of you were aware of, 5 in public safety, 2 in parks and natural resources, 2 in financial management, 2 in public works, 2 in property management, 1 in county administration, 1 in the county attorney's office, 1 in human resources, 1 in redevelopment and economic opportunity, and 1 in building and development services. We've had a total of 105 exposures identified through contact tracing, and we've had 3 deaths. In addition to that, 5 of our positive cases in the past couple of weeks have been in fully vaccinated individuals. The outbreak of cases in the administration building on the 9th floor, where the county attorney's office is located, where my office is located, and the county commissioners, as well as financial management. An example of how quickly COVID-19 can spread through an organization. An individual in financial management who was unknown with regards to being infected attended a large meeting in the conference room to address the American Recovery Plan and how we would be able to deploy those dollars. That individual became ill. And we had someone in my office contracted COVID from that individual, and that person was vaccinated with the Moderna vaccine. You saw me leave with a mask. One of the things that we've implemented, and I'll go over the new protocols with regards to quarantine and isolation, I was wearing a mask because I'm fully vaccinated, which the current statistic shows that you don't need to quarantine, but because the individual that I had contact with who came down with COVID-19 and became quite ill was fully vaccinated with the same vaccine that I had. So I've been wearing a mask throughout the day in the building, wherever I am, for that 10-day incubation period. And so we have changed our protocols. We identified why we were having spread in various departments, and we have mitigated that, and we have developed new quarantine guidelines in collaboration with the Manatee County Department of Health. With that, I'll go ahead and open up for questions.
Why was it spreading?
Pardon me?
Why was it
There had been a practice prior to me coming in as administrator whereby individuals, when they were identified as having contact with a known positive case, were sent for testing regardless of how long it had been since they had contact with a known case. And if they came back with a negative test result, they returned to the workplace. Given a 10 to 14, a 3 to 14 day incubation period and or working off of a 10-day period, obviously if someone was 4 or 5 days out of contact with a known case, went to get tested, highly likelihood of them testing negative because they didn't have enough of a viral load or enough antigen to test positive, returned to work. A couple days later, they become ill with COVID-19, and they had an opportunity to spread it to fellow coworkers. One of the policies currently in the employee manual is a communicable disease policy, which was in place long before COVID, which requires an individual who feels they may have a communicable disease or knows they have a communicable disease. It is their responsibility to ensure that they take action to prevent passing that disease to coworkers. So we obviously are reminding employees of that. And as you know, we have posted signs since the first outbreak in IT, which resulted in 2 deaths in 1 week, to highly recommend that unvaccinated individuals who are in the building, whether they're employees or visitors, should take advantage of the mask which we provide, which are KN95 or our N95s. The CDC, as you're probably aware, now for communities with high levels of spread, is recommending that when indoors, regardless of vaccination status, you wear a mask.
Were all the employees in this building or were they in other facilities?
No, as I ran through this, we've had employees in various locations. Among property management, we had cases of individuals that were working at GT Bray outside, but they share a small office together and drive around in the same trucks together.
Do you have any indication that people in the public, members of the public, were exposed to any of these employees?
We're not aware of it. We have been really, encouraging for the past few weeks that we go back to virtual meetings. We have reduced the number of people in the executive suite and are, through this 10-day period, trying to avoid individuals from the outside coming into those buildings. And
Future commission meetings, are they going to go back to virtual?
no, as you saw, we've had 2 commission meetings, and I would say, I guess, 3 of us on the dais have been wearing masks for one reason or another. So far, we are continuing business as usual.
Scott, how concerning are these numbers?
They were quite concerning, especially the number of vaccinated individuals. But I'm confident since we had the first outbreak, I've been getting daily reports. And, obviously with my background as an epidemiologist, I began identifying the pattern and started looking in detail with the practices that were in place and that were being followed. And I'm comfortable that I have been able to address why we were seeing some of the spread. I can tell you the utilities department is one of those areas where there was a lot of vaccine hesitancy. In addition to that, there was a lot of resistance to wearing masks. And that's why you have so many cases. Many of you are aware of the problems that we have with trash collection. We use private companies for garbage collection, recycling, and yard waste. There was a meeting of utilities individuals as well as individuals from Waste Management and Waste Pro that met in planning for Hurricane Elsa, and that was the source of one of the outbreaks.
What have you done to the building such as the blue floor?
We went through, and interesting enough, as you notice, these floors are an antimicrobial epoxy that has a 5-year life of really being antiviral, antibacterial. In addition to that, as we identify known cases, we go through the disinfection protocols. Not only have we purchased the foggers, but all of our property maintenance individuals have gone through training on the proper protocols for disinfecting those areas. In addition to that, throughout county government, we began a few weeks ago installing UV light systems in all the air handlers. So all of the air is being disinfected 24 hours a day.
You say outbreak, but just how many people were infected by this one person who was sick, and has he gotten better?
Well, I would say where the largest spread was in utilities. That's where one of the deaths occurred last week. It was an individual that had been identified by contact tracing to have been exposed. The individual was home on quarantine, became ill rapidly. His spouse is also a utilities worker, and found the employee deceased. Subsequently, the spouse has become ill with COVID, but fortunately was home on quarantine.
Dr. Holtz, was that person working in this building?
No,
What building
no.
were they working?
In one of the utilities buildings, and I'm not sure of the location. We've got a number: 66th Street, 59th, out at the dam. No, they were not vaccinated.
How do you get that message across? I know it's kind of the topic right now of everyone, but how do you get that message across?
That's why I'm before you today, and that's why I appreciate the press's engagement. Look, we are seeing case volumes at the levels of the peak last year. When we look at our employee cases, you can count the 10 days after 4th of July weekend, and we started to see those cases spike. The Delta variant is the most prevalent variant. We know that the Delta variant is causing breakthrough infections in individuals that have been vaccinated. We now are beginning to see countries offering booster doses of the vaccine to bump up the protection of the vaccine. One note, those of you who were following the outbreak in IT on the 7th floor here, we finally got the gene sequencing back on Monday from the health department, and it was the alpha, I think, 117 variant. So it was one of the original variants, but for some reason, it caused that high degree of spread, and as you know, two relatively healthy individuals without comorbidities, passed away in that 1 4-day period. But that was the alpha variant, and what we're dealing with today is something far worse with the Delta variant, and I think the iota. I'm not real good on the Greek alphabet, but
During the last outbreak, we obviously had a vaccine clinic for employees and for the community, but we really encourage everyone to be vaccinated. Now that we're seeing this outbreak again, and we're seeing that it is a different kind of the virus, at least we think this one is probably the Delta variant, because we're seeing those breakthrough cases. Are we planning another vaccine?
yes, we are. In fact, we've got a couple of additional vaccine clinics. As you know, the county commission has been pretty open with regards to vaccines, and they took the position they did because people were getting the vaccine, and we knew that the vaccine works, and the vaccine does work. If you look at those 41 cases, with 5 of them being vaccinated, I will tell you one of the individuals in one of the departments, basically EMS of all places, had been vaccinated in early January. And we know that there's a limit to the time with which you're going to have coverage, and we're just beginning to realize that we may need to use a booster to give people continuous protection through vaccination. There currently hasn't been no discussion of that. I mean, we're a community of choice, and I think we have the fortitude, and I will tell you, in these departments that have had a large number of cases, and especially when they have a death, we're seeing an increase desire to go ahead and get vaccinated.
What is your advice for your employees as well as the residents here in Manatee County?
It's much like we're discussing. I will be leaving here, going to our studio and recording a video message for employees, informing them of what's been happening. Of course, it's better to get the information directly before it's filtered through a lot of people. And the county has made available the appropriate mask. I appreciate looking out, and most of you are wearing KN95s or N95 masks, and that is the known way to mitigate spread of the virus. The vaccine works. It worked in the beginning. It still works. People who were in the first round of vaccination, I'm confident in this country, will be offered boosters.
And no mask mandate to go into a county facility?
Nope.
Dr. What about sure we get this right? So the new rule is you have to have a negative test on your 10th day?
No. Look, and that was the problem. The problem was there was a reliance on a negative test to determine somebody was not infected or was not contagious. And now we've ensured that the proper protocols are being communicated. So when we have an employee that's been identified through contact tracing, they will be home on quarantine for 10 days, and if they're symptomatic, 10 days plus at least 10 days plus at least 24 hours of no fever without being treated with anti-fever medication, and if they were symptomatic, symptoms lessening, and then they're allowed to come back to work. If someone is positive, it's 10 days of isolation, and again, 10 days of isolation, and at least 10 days of isolation and 24 hours of no fever without taking medication to reduce fever, and improving symptoms with the exception of the loss of taste and smell, because that can go on for a long period of time. And I think that's one of the misunderstandings. Because of the various sensitivities of the COVID test and the timing of the test, that should not be relied on within a short window of time to determine whether or not you've been infected.
Dr. House, can you reflect?
I'm not aware of it yet. I do not know which cases the health department has sent specimens to Jacksonville for the gene sequencing. I do know from communications with the health department that the Delta variant is the dominant variant in Manatee County, as in most places in the country right now.
Dr. Hooks, can you reflect on the fact that now when the media was here a month ago, you had 2 employees of the county who were vaccinated. You now have 3. So can you reflect on your feelings, how people are feeling? This is a moment for those that work here, for yourself. I mean, this is very sad.
It's sad, and really the main point is, look, this is a virus, and viruses are very tricky. They have a desire to continue to live and to thrive and to find hosts. And so what we're seeing is not unexpected, given how many millions, tens of millions of people around the world that have been infected with this virus. And as it goes from one person to the next, you have those mutations.
What are you doing to?
That this pandemic is not behind us. It is still here. We are in our kind of new normal. This virus has proven to have staying power, so to speak, and that's why it's important. Look, we have traffic. We are a thriving community. Our economy is thriving, and we cannot let a disease stop that economic growth, because this is public health. It's here. And quite frankly, we know how to minimize the risk of contracting this virus. I will tell you, I've had an office in Taipei for a number of years, and Taiwan has a population of about 24 million people. Florida has a population of about 22 million people. And I will tell you, I think in February in Taiwan, they only had about 20 or fewer deaths from COVID-19. Florida has had thousands, okay? So we're here, we're doing our part to help protect our employees, and we're communicating with the public. about how we continue to move forward with our lives, educating our children, continuing to prosper economically, but people have to take personal responsibility. We each have a responsibility for our own health and our neighbor's health. And the story is the same. Vaccinations work. If you don't want to be vaccinated, reduce your risk by staying away from people that you know may not be vaccinated. And if you're sick, don't come to work and don't come to school. One more question.
Anti-free masks, is that you?
Any chance of us following the federal government and mandating the vaccine to employees before they come to work? And why not?
First of all, I don't set policy in Manatee County government. That's the board's role. I don't know many places in Florida, except for maybe South Florida, that would kind of take that direction. I do believe in the freedom of decision and choice, but I also believe in public health. We all have a personal responsibility for ourselves as well as our neighbors. Thank you all for being here.
You guys squared away?